what actually strikes me is that despite the different national contexts and the strategies, whether in Italy, where we have these structured CD/CD networks, or Slovenia with a strong stakeholder collaboration and national action plan that Mercedes talked about, or even the UK now with the creative and design-led approach, which I think is really interesting, we are all still grappling with the same fundamental challenge. I mean, how do we successfully translate the scientific and technological progress into service models that are, first of all, equitable, but also mostly financially sustainable and responsive to the real needs of patients and carers? I mean, this question comes back again, and that's what I was always thinking about, when everyone was talking. From the French perspective, we've had several national dementia and neurodegenerative disease plans since 2001, with very strong emphasis on early diagnosis, like everyone else, mostly through the creation of memory clinics, so similar to the CD/CD in Italy. And more recently, we focused on integrating care closer to the community. But same as in Italy, same as in other countries, the implementation is very uneven across all regions. And all the digital health innovations that we have, they're not yet fully embedded in practice, unfortunately. Earlier this month, the newest French national strategy for neurodegenerative disease was launched for 2025 till 2030. And they mentioned this significant regional disparity in diagnosis and access to solid treatment strategy. They also mentioned several strategies like home autonomy support service, which we know highly relies on technology for remote monitoring and teleconsultations, but unfortunately, they don't really talk about applying the technology advances clearly. So yeah, I think this question comes back and back. Mercedes, you highlighted strong collaboration across ministries and civil society to create these strategies, and we have that. I think all of us have that. But again, we do need to move from very well-written strategies to actual implementation, and mostly that survives political turnover and funding cycles. I mean, we've seen that a lot. We had a lot of turnover in France the past couple of years, and this delayed the launch of several strategies, including the dementia one. So this common thread that today's talks, it reminds us that the policy documents and all of the innovative therapies, they only have meaning when they are translated into real-world practice. And the systems really need to integrate the medical, the social, and the community dimensions. So yeah, again, I know everyone says dementia, it's not only a biomedical challenge. As scientists, we know that. It's also a societal, a political one, an economic one. So perhaps, yeah, the key and most urgent questions of all is, as these new therapies, as these digital tools and creative approaches become available, and we do have them, how do we ensure that they do not stay in pilot projects, research projects, or only maybe elite centers in the country? And how do we ensure that they actually reach the people who need them the most, basically patients and carers and caregivers, and mainly respecting the equity and the financial sustainability of these programs? So I think that would still remain the question, the big question.
Thank you very much. You linked everything together. Christina, you want to react? I would just ask Diane in the background just to look at the chat, and I will ask you just at some point to bring up any question which is from the chat. But let's, Christina, please react to just what Chirine has been saying.
This is such a pertinent question. Thank you for that. I think this needs a policy change on the part of the funders. We've got already a lot of, actually it's already happening. One of our grants was already one of those grants that works towards getting commercialization, let me say this more generally, but quite often that commercialization is geared towards setting up companies, which may not be the thing to do. So I think that funding landscape needs to become more flexible, so that there are intermediate ways of doing things. There are simple things like licensing things like which is what we've done with our game. There are the the hardcore ones where there's developments that then can become spin-out companies or, you know, whatever. But there are lots of other things that are happening. For example, we're looking at the service development at the moment. And there have been other volunteer service developments in the past, in the Netherlands, for example, which required setting up a separate center, and then the centers were left over, but the volunteering disappeared. So we're trying to embed the volunteering with the agencies that we're working with, like HUK and the Alzheimer's Society. So, and that requires a completely different model that isn't kind of there yet.
Yeah, and I think that, well, I can just ask Sofoklis before going to Juan, give Jer, because Sofoklis has a hard stop at 4. So, and also because actually it's really related to what we just discussed. I mean, we have the need indeed to go to implementation. And Sofoklis, you've been developing, you've been you have been a developer, a successful one, because your product has actually been approved, not only CE marked, but also approved into possible reimbursement schemes, especially in some countries, like in Belgium, in my country, for example, your Essentia, your product has been approved and could possibly be prescribed, basically. As version. So that's clearly the link to implementation that we miss today, to say that we need strong and useful, usable, meaningful, adapted, targeted product, but also supported. So what is your perspective? How can we better link the implementation? How nice products can be really used with, and how can we progress?
Look, thank you very much for this introduction. As you know, and those of you that don't know, we are medical device manufacturers. We have one single device, which is software as a medical device. So it's an app for patients and a clinical dashboard for clinicians. We target mainly chronic diseases, and this is our intended purpose. And we have been somehow, to some extent, an outcome of European R&D research. So we're very proud of this. Now, I heard very interesting points of view. It has been very insightful to listen to the previous speakers because yes, dementia is a huge problem. I can connect to that with people that I have around me, close people and relatives that they have suffered from dementia. And I understand all the complications, or I think I understand all the complications from a policy perspective. Now, I heard many of you, if not all of you, talking about digital health. Digital health is something which is quite, I would say, a case. It should be a case study, because back a few years back, everybody was having a very, very big anticipation that it will skyrocket, and everything on health is going to be based on, you know, on devices. The truth is that this has not actually happened like this. And not only in Europe, but in the US as well. In the US, we have experienced the bankruptcy of huge companies, manufacturers trying to provide such solutions. And behind that, the reason, at least the way I interpret the data, is that the business model is has not been very strong, and the go-to-market strategy. And there is where policy makers can make you know, the difference. For example, in Europe, I don't know if you can agree with me, but it's very difficult to go directly to the patients. And the experience has shown that knocking doors of doctors is also a very complicated process. So if somebody targets hospitals or care centers that they have cohort of patients, whether elderly patients with dementia or other chronic disease patients, then there should be something more than offering good health, because everybody is interested about the better health. But at the end of the day, the decision makers, they care a lot about the return on their investment. So if they're going to pay the manufacturer or the operator X amount of money, they want to make sure that at least they get something more than that. Now, in Belgium, like Luc mentioned about the reimbursement, there is a framework. There is, of course, a framework also in Germany, in France. I think in Italy it's happening now. And I guess that naturally it's going to happen all around Europe. So I can share with you our experience from Belgium. In Belgium, Regime has given a focus. So actually, let's put it say the public healthcare system has given a focus initially on heart failure because they had data. They had data to demonstrate that heart failure patients, I mean, it's a significant amount of the population. The impact can be quite significant if you manage to help the patients be more adherent and through some other services. So they have introduced the framework. I would say in a kind of a fast track, which is something very interesting, and of course has been very. I think it's running for 9 months, and it should be considered as very successful. But again, I would like to focus on that. There has been a framework to demonstrate how data that has been derived from different sources can provide, the willingness of a payer to reimburse solutions. Because if the payers don't pay in Europe, it's going to be very difficult to adapt digital solutions. Now, with elderly people and people with, especially with dementia, I understand it's even more complicated because it is not. We have to talk about early dementia and or include also other caregivers or family members, into this digital health kind of program. So, as a conclusion, I think there is a lot of opportunity for the governments and for all of us to exploit in the next years the outcomes of all this research and all this development that is happening. The policymakers certainly they have to prepare the framework to support this thing, and we should also support the policymakers with data because otherwise it's going to be difficult for them to take that.
Thank you. Thank you very much, Sofoklis. I immediately want just to give at least one word to Juan, who is also unfortunately a hard stop. So, but Juan, at least, what can you just try to tell us? What is your strategy to try to solve the issue that Mercedes has also been mentioning in the presentation with this time gap? Basically, we have innovation, we have nice solutions on the market, but actually it takes too long to adopt them and to implement that. So what is your strategy in TIC Salut to try to deal with this issue?
It's very difficult to answer this question in few seconds, but clearly we have the big problem is the adoption, the final adoption of these solutions that clearly could help to the prevention, to take care, better care of this situation. And in terms of adoption, it's clear that we have a problem on how is the business model of these solutions. So who will pay and how we will pay this. And this is the main problem that we have. But talking about dementia and all this, also it's clear that we need integrated systems, integrated solutions to take all together with the pathways, with the protocols. So we need to merge the patients, but also the caregivers and the professionals with the protocols and pathways. And in this case, only with this, we are not in a success situation in Spain. We have several solutions running in terms of integrated solutions for the teams, but not systemic solutions. So we have nice local experience with some providers, but we don't have a unique solution for all the pathways and for all the systems.
Yeah, but just, I know you're in a hurry, but I like this question. So imagine that you're very confident about a screening tool, for example. Yeah. And that really can drive the people towards the specialized clinics for dementia when they believe they have been pre-screened for so on. So how would you be developing this? Because I don't see any country having been developed or supported such an approach yet. So what is your source? Are you preparing yourself for this?
Yeah, of course, we have the systems and the professionals prepared to prescribe these kind of solutions, but we need solutions previously validated by all, and this is the first point. So we work a lot in the validation of the, what we name it, digital actives for the citizens, for the patients. Mm-hmm. And we are working together with the European Union in all the process to validate, to assess and validate and certificate these solutions before to extend to all the citizens. This is sure the way, but it's not the only thing. I insist that we have a problem with the business model of these solutions. Yeah.
Thank you very much, Juan.
Thank you. I'm sorry because I am.
No, I know Thank you very much, and very sorry for the delay. Thank you very much for being there. Diane, any question coming from the audience that our speakers and panelists would be happy to comment upon?
I will be the backup look of Diane, less charming, but I will be the backup because her mic seems to have a problem. So yes. There is one question, but to me, the very first question is, does the audience agree to stay for 5-10 more minutes? Because it's already 5 minutes have passed. And opening question, there is one question that came from Sarah, but opening the floor to that kind of questions is at risk of leading us to at least 10 minutes of conversation with the panelists. So how do we agree to that, or do we simply say, okay, we will need to reconnect in the future?
Oh, let's go back. Let's go, please. Let's go.
So Sarah, you are still online, yes?
Wait. Yes.
Yeah.
Hello.
Yeah.
Hello.
We
yes.
hear you.
Sorry,
yeah, we hear you.
Because I had the question just launched. Yes. So I was wondering which is the situation in your countries about digital technologies for neurorehabilitation or cognitive decline, and if you are using them, if they are reimbursed. So because I saw the answer from Camillo, but from some experience that I have, for example, in Italy, I know that the majority of them are already included in funding research programs. So it's quite hard to have actually them prescribed and reimbursed. It's true that some IRCs, which are hospital and research centers, are using them, testing them, but they are not like in the full implementation process. So I would like just to know which is the situation in the different
in
countries.
Slovenia, in the UK, in France, and elsewhere. Okay.
Thanks.
Okay, begin, Chirine. In France.
Yes. So as you said, actually, in France, it's mainly in the research programs. Very, very little have been implemented in clinical practice. So they're not. Most of these options are not reimbursed by by our health insurance. So only the privileged, if I can say that, have access to these options, unfortunately. We're trying. I mean, I work for a patients association, so I think mostly nonprofit organizations and foundations are trying to push and sometimes help people get access to these options, these technological options. Unfortunately, it's still very uneven for the access for all people in France.
Thank you. And in Slovenia, Mercedes?
We don't have a digital solution for screening mild cognitive decline. We also have this possibility only in clinical settings. But I'm thinking that could be useful to have a parallel like with the screening for cancer. For example, in my country, we have very successful screening cancer programs. There are 3 at the moment. and they are paid by assurance, performed by clinicians. And I think that this could be one of the solutions, considering also a new medicines, because I think that we need a shift from a diagnosis of dementia to the screening.
Yeah.
I think that this is the first step, and I saw these parallels with screening programs for cancers.
Thank you, Mercedes. And I see that Cristina has shut his camera. So Camillo, maybe first in Italy. Just before you react, it struck me that when I was surfing on the web, that actually there was some pop-up asking me if I wanted to be screened for Alzheimer's several times. So though actually you see that many people are trying to position on the possible fear of people and asking that. So there is a risk basically that business will take over if we don't come quickly with nice and good solutions. So I mean, technology is there, whatever we do, but we need to try to govern it in such a way. And that's why it needs so much to be included into the policy aspect so that there is some reference. I give you the floor, Camillo, for your response for Italy.
Okay, no, look, you are completely right. In Italy, we have registered some devices and some tools for remote administration, for example, of neuropsychological investigation and clinical tools. I said before in the chat that in Italy we have reimbursement provided by the health system for technological assessment, clinical or neuropsychological assessment by remote with devices. But I have to say that sometimes clinical are not too much in favor to use this, and they prefer to use in presence. So probably we have to do a work in increase the trustworthiness of also clinicians in use of these tools. Mostly of the new devices and the platform in Italy are probably in the next years will be used for screening tools for detection in the normal population of people that are at risk. Not only by cognitive assessment, but also by other tools, by saliva or also blood examination. How much of this will be included in a national platform, I don't know. There are several drawbacks to overpass that are privacy and some other things that must be done. But I have to say that politicians are ahead to clinicians in this sense, in some way.
Thank you, Camillo. And this, Cristina, we heard your statement concerning that less digital was wanted maybe by people already affected, maybe not the case for people not yet affected. But what is in use, basically, then in UK?
In terms of design or in terms of diagnosis?
Both, I think. What do you believe is already there and will be there very quickly and was already approved? I think that was the question.
Gosh, that's a wide question.
but
I mean, in terms of prevention, I think there's a lot going on. I've mentioned the social prescribing, but the UK is very, very strong on volunteering. So there's lots of volunteering organisations which focus on reduction of and other campaigns on reduction of loneliness, especially for people who move into retirement. Quite often they lose a large circle of people that they're used to engage with. They might feel less worthy. Again, it's almost a pre-stage to dementia, where something similar happens in an even more drastic way. So I think anything that's community engagement. So Age UK is the big provider. They don't just provide for dementia, but they provide advice and contact for older people in general. So that there are a national provider or organization, but that works in franchises, so in local communities, basically. They are quite strongly engaged in these things, but then there's other sort of upcoming organizations that are sort of social prescribing organizations, which means if you go to your GP and you're depressed or you're lonely or whatever comes out, they might, or you need a bit more activity, but you can't do it on your own somehow. They prescribe you to go to maybe an art class or, something. So it's the recognition that both creative aspects, leisure aspects, social aspects really improve health and well-being. So from a mental point of view, and that usually keeps people more active and that ensures that they're better at a physical point, from a physical point of view as well.
Yeah, what was very interesting is a colleague of yours, also from Manchester, but not from the same university, actually showed in the previous webinar that the use of the community aligned with technology for screening was extremely powerful. So that might be also the bridge. Basically, it's bringing also part of the problem, not completely out of the clinicians, not at all, Camilo, but at least helping them to bring the patients who need them to be further assessed quicker and so on. So I found that approach very, very interesting, and that might also bridge the gap between the fear of technology and the need to screen much earlier.